Makes a difference.
Good morning, my name is Dr. Michael Auer. I'm a physical therapist and Director of Rehabilitation Therapy Services at DHR Health, Inpatient Division. I've been a physical therapist for about 18 years. I started as a physical therapist assistant, which is an associate's degree. I did that in San Antonio, Texas, which is where I'm originally from. And then I went on to receive my bachelor's and my doctorate in physical therapy at the University of Texas Health Science Center. My current role at DHR is mainly involved in administration for the inpatient service lines that I am over and the development of the departments that I supervise as well. I am specifically over the acute therapy lines, which is when the patients originally come into our hospital for surgeries and things of that nature. The NICU, Neonatal Intensive Care Unit, which we have dealing with premature babies, and the inpatient rehab service line dealing primarily with patients with neurological disorders. I've been in administration here at DHR Health for about 4 years. I've been working with DHR Health since I got my physical therapy degree for about 9 years, and I was originally here at DHR when the rehab opened in 2005 when I was still a physical therapist assistant. The field of therapy is growing rapidly, and there's many different specialties that you can choose to partake in developing a career in. Specialties such as neurological patients, orthopedics, sports, acute, neonatal, vestibular, lymphedema, wound care, cardiopulm. All these areas are specialties in the realm of physical therapy. It's a very rewarding field. My specialty lies in neurological patients such as traumatic brain injury, stroke, and spinal cord injury. I have recently received certifications in the field of robotics, which we have here at DHR Health. We are the only facility south of San Antonio and Houston that has robotics, and we are a center of excellence for the ExoGT, which is a robotic exoskeleton that helps patients with neurological disorders such as stroke and traumatic brain injury and spinal cord learn to walk again. Robotics is a very fast-growing field right now, not only for bioengineering, but also for physical therapy. And so whether you want to go into bioengineering, which is an awesome field as well, or specialize in robotics in the field of physical therapy, it's a very exciting field, and to see the progress that patients make with this type of technology is amazing, and I'm proud to say that we have that here at DHR. Physical therapy is a very competitive field. You have to have an undergrad degree to pursue that specialty. Keeping your GPA above a 3.5, preferably a 3.8, is highly encouraged to be a competitive candidate for admission into the PT program, the Doctorate of Physical Therapy program. After you receive your undergrad degree and you take a GRE, which you now have to maintain a high score on that as well, those are two things that help you for admittance into the Doctorate of Physical Therapy program. Along with that, they're looking at things, how you serve the community, other volunteer efforts that you do, your volunteer hours, letters of recommendation. These are all things that help your chances of getting into physical therapy school. When I applied, which was back in 2008, there was about 500 applicants. They interviewed 100 and they accepted 40. And now the field is even more competitive, as it is, I would imagine, for all the healthcare professions. But once you're in, it's a very rewarding program. You get very close with your classmates, and it's very rewarding when you come out to be able to help patients that can't even sit on the edge of the bed, and then you're teaching them how to walk again and to be able to interact with their families. It's a very rewarding profession. It's a very rewarding field, and the program is very exciting, very hands-on. There is classroom time, but it's a lot of hands-on. So if you don't like sitting at the desk for a long period of time, this graduate program is for you. There's a lot of different avenues that you can pursue in this field, but I wouldn't change it for the world. There's other specialties in addition to robotics, such as adaptive sports. Adaptive sports is a program where we're teaching patients how to play competitively in wheelchair sports. And so right now at DHR, we're currently in the process of developing such a program to involve patients with spinal cord injury and amputee and the sport that we're focusing on is wheelchair basketball. And so, fun fact, the University of Arlington has a competitive wheelchair basketball program at their university in which they give scholarships for patients or people with injury to play competitive wheelchair basketball. It's one of the top wheelchair basketball programs in the nation, and so we've been in contact with them to help develop our program as well. So these are other exciting things to be involved in as a physical therapist. At DHR Health, we have many different service lines. Our Orthopedic Institute, which is outpatient, specialized in sports therapy. We have our Therapy Institute, which also has an aquatics program where they specialize in patients with neurological disorders, vestibular disorders, and aquatic therapy. We have lymphedema therapy available, pelvic floor therapy available, and also our inpatient rehabilitation hospital where we also have specialized in neurological patients. All specialties are represented here at DHR Health, and so if this is a field that you are interested in and you want to come back and give back to the Rio Grande Valley, I highly suggest this field. You won't regret it. Take care.
Next